Well, Dr. Dvittorio is a pulmonologist with the Mobile Infirmary Health Systems. He was with us Wednesday night when news of Nick Saban's positive COVID test was revealed. Tonight, I wanted to know about the testing that the coach is doing and just how accurate it is. Dr. Dvittorio, thank you again for joining us. And I just wanted to start quickly. We're all assuming that Coach Saban is taking one of those rapid tests to determine whether or not he has COVID. Number one, just how accurate are these rapid tests? And can you still get not only false positives, but false negatives from a quick test like this?
With respect to COVID testing, a lot of the testing that is done is the rapid nasal swab testing. And depending on the manufacturer, there are numbers, sensitivities, and specificities as to how many false positives or false negatives may be assumed. Now, the one thing that is relatively clear is that there tends to be less false positives than there are false negatives.
And I know we can't be specific because obviously you haven't examined Coach Saban, but we can assume that he must be taking one of those quick tests, and he's already had one negative result, and he's waiting on two others. So you feel confident that by taking this quick test that he will get a true reading. Is that accurate?
If you start testing somebody such as Coach Saban or football players or other athletes routinely, then this conundrum is going to come up where you have a positive test in the absence of symptoms, and therefore what do we do with it? So I think it is appropriate that if we get one positive test and we have a figurehead such as Saban who's around many people, then we do need two, maybe three, if that's what their guidelines of the ACC are saying, to clear him.
Well, Dr. Dvittorio also told me that the prevalence of false positives is rare, and it can sometimes take people 5 to 10 days to present symptoms of COVID. But he also told me he would not be surprised to see Saban on the sidelines tomorrow night.